Hi everyone, my name is Mariana and I'm a designer working with Healthcare Improvement Scotland Service Design team. And today I'm going to be talking to you about visualizing a person's journey and experience of a service and how we've developed a package of tools to help teams across Healthcare Improvement Scotland visualizing journeys. We will be sharing these tools with you after the presentation, so you'll have all the links and hopefully you can use the templates that we will be sharing in your own work. All right, so we'll start by going through how we started and a bit of an introduction to the brief and our starting point in the project. Then we'll quickly talk to you about the internal research we've done and what we found out through speaking with different teams and departments across Healthcare Improvement Scotland. Also, how we've developed these tools, so what we took into consideration, what were the requirements, but also constraints when putting together the tool. And then I'll do a bit of a demo of the tool so you can see how it works in practice and hopefully use it afterwards. So initially we started with a very simple brief. So we knew that journey mapping is done widely across Healthcare Improvement Scotland to visualize people with lived experience journeys with one, but also with multiple services. It is a really important tool to represent the voice of people that often aren't in the room with us. But we also knew that the lack of guidelines and best practice examples made it difficult for teams to visualize a person's journey without it being too overwhelming, confusing, or sometimes taking too much time to be able to visualize that journey. So we knew that we wanted to create something that was reusable, that included guidelines and best practice examples. So teams and people across Healthcare Improvement Scotland with different levels of journey mapping experience could use them. In other words, I think we wanted people in the organization to start with a why, not with a tool. So it's not really about the output in the journey map as a tool, but about finding a way to bring the voice of people with lived experience into the room and into conversations that we're having. After talking with people across the organization from different teams, we found out a couple of different things, but that mainly that teams are not taking the time to really reflect on the purpose and decide what information needs to be highlighted to make the journey map easy to read and like concise. So as a result, journey maps were often overwhelming and difficult to read with too much information. We also knew that teams were lacking best practice examples and guidance and easy to use tools to visualize people's journeys across one or multiple services. And obviously, this makes it harder for teams to perform. And as journey mapping is done widely across the organization, could be either done by doctors or social workers or anyone really in the design team that wants to represent people's voices. So we knew that we wanted to create something that could be used by people with different levels of design experience, but also journey mapping experience. So this is just a few examples of what journey map looked like across the organization. So as a result of all these things that I just mentioned earlier, the journey maps across healthcare improvements Scotland looked completely different across different teams. Often they were too overwhelming and difficult to read because they're just trying to convey and to put across too much information, or they're using a visual that makes information harder to read and makes things more complex than they could be, which is the exact opposite of what we want a journey map to do. Right. So knowing all this and knowing that we wanted to create a tool that tackled all these problems together, we started by mapping our requirements or things that we knew that this package needed to have in order to be sustainable in the long term, and also our constraints. So knowing that Healthcare Improvement Scotland is obviously a big organization, and with that comes like different barriers to adoption. So we knew that we wanted to create something Iterative that worked almost like a living document, allowing for feedback loops and improvements. So it's also sustainable in the long term. We knew that we wanted to create something consistent, but at the same time, giving people flexibility within clear boundaries and guidelines. We wanted to create something obviously easy to use for people, as we mentioned before, with different levels of journey mapping experience, and also include examples of how the tool is used in practice, so it inspires people across the organization to use them in the right way, and also create something that goes beyond an output. So it's not just a journey map. It's something that represents the voice of people with lived experience that often are in the room with us, helps teams rethink and brainstorm about different ways of providing services. And in the end, I think that the goal and the outcome would be help people with lived experience overcome the challenges that we represent in the journey map. So we ended up creating a reusable package containing multiple tools for different moments of research, analysis, and ideation. So one of these tools are the event cards. So it's a paper tool to help you capture service touch points during an interview with a participant. Then we have the journey map templates. So it's a series of templates that focus on different elements in a person's journey and highlight different components of that journey. Then we have a set of brainstorming cards to prompt teams to think about future service improvements. And then we have reflection cards to help teams reflect about current service challenges and understand why they happen. And we can use these different tools at different moments of the double diamond. So the event cards are a paper tool to help people capture data during the interview. So they include prompt questions, working almost as a discussion guide. And in order to be trauma informed, you can cut the event card sheets so participants can move things around and organize the steps chronologically, which can sometimes be difficult, and we knew that at least from experience. So we wanted to make something that was very flexible to be used in interviews. It is important to have something in a piece of paper so you can write things along in the interview, but also that the person that you're interviewing also sees what you're writing and they can also have an input in it. So they feel part of the conversation. So we wanted to make sure that we had something in a piece of paper. After the interview, you can choose one journey map template in the package based on the findings that came out of the interview and what information you want to highlight. So you can choose from the different templates that I'll walk you through in a second. And we also wanted to make sure that we had these different tools in a variety of formats to ensure that everyone across the organization can use the software that they're most familiar or comfortable with. So hoping that's one less barrier to adoption. All right, so we've developed 4 different journey map templates for different purposes. So all templates have flexible components to ensure that it's flexible and that teams can use it in different ways. Whether they want to showcase medication that the person lived with lived experience was taking, their mental or physical health, or anything that feels important to highlight in the journey. So the 4 different templates are template A, that should be used when we want to highlight a sequence of events, feelings, and challenges that the person went through. Template B highlights the opportunities resulting from challenges, whereas template C should be used when we want to highlight what's happening in the backend. So in a way behind the curtain. So what are the processes that staff internally is doing? What are the steps that they're taking? Policies that influence the decisions and the actions that are happening behind the scenes, and also the data. How is the data stored? How is the data gathered? And a series of questions around data. And then template D should be used when we want to highlight all the organizations or all the stakeholders that are involved in a person's journey. How to use. So in order to make it super simple to use, besides making the tools available in different formats, we've also created them as templates in Miro. So teams can simply add the templates on the Miro board and fill it in instead of having to copy from one board to the other and so on. Now I'll walk you through a few examples of how we use the different templates, hopefully to inspire you how you can use them as well in your work. So for template A, this is an example of how we used it to visualize a story of 19-year-olds that suffered from anxiety and later found one-to-one support from Bernardo's. So this journey just highlights the touch points. Also we added in the component of age because we felt it was really important to highlight the person's age in this map. And also, what are the drop-offs? What were the drop-offs and points where important points in the person's journey? Template B, and this is an example of how we use it to visualize the story of a person that started self-medicating because of a severe tooth pain infection for over 7 years, and highlights what could have been done differently, like using and utilizing wait times, providing holistic mental health support, or improving follow-up support to avoid relapses. So this one really focusing, this template really focuses on missed opportunities, on what we could have been done differently. Template C, this one focuses on the different backend actions taken by different stakeholders and showing the policies and the data channels at each stage. So this is an example of how you can focus and how you can use this template to highlight what happens behind the curtains. And then template D, this is an example of how we used it to visualize a story of Adam, who is 21 years old and was constantly being referred between different care providers. So what we've tried to show here is a comparison of the journey before and after Adam joined the early intervention program, which provides a more holistic approach to care. So we wanted to show the comparison of constantly going back and forth and being referred to different providers, comparing to a more holistic approach. Within template D, that highlights the different stakeholders involved in a person's journey, we've created different versions of it and ways of showing that information, so teams can choose what's the best option to show that information. So we knew from the beginning that we didn't want, as I was saying earlier, that we wanted to create something that is consistent, but it's at the same time flexible. So you can choose different ways of showing the same information. We have now launched our tool internally, and we are making improvements as we go and as feedback comes in. But we also wanted to share these tools with you, so you can click any of these links for the different formats available. So you can use the Miro, PowerPoint, but also our online resource. And as we want to keep improving the tool, we'd love to get your feedback. And on Miro, there's a board for feedback, and you can populate it as you wish. And hopefully we can make these improvements as we go and as we get more feedback. That is it from me. Thanks for listening, and I hope you found this interesting and also useful, and you can use these templates in your work. Please, any questions, pop them in the chats, and we can have a bit of a conversation around how we can use these tools.